Marker. Now, this is a picture that struck me. This is a picture from Time Life. This is in the 1970s. I still have that issue with me. Look at the empathy on that doctor's face, the way they've kept he's got his hand on the patient's head. This is from Chile, a country which didn't allow abortions for any indication. And this woman told her doctor that this had been her 26th criminal abortion. Okay, so this picture gives me the touch of a story, the eloquence of a visual, and tells you how powerful media is. Now, you would think that happens in Chile where abortions are illegal, and unfortunately, this still happens in India. This was a colleague of mine at Holy Family Hospital who had a patient who came to the hospital with a foreign body in her uterus. You know, when unable to access abortion with dignity, women will access it anyway. And for a woman in 2018 in the metropolitan city of Mumbai to have to go through this humiliation is something that's just unacceptable. Now that brings me to the question as to why women risk unsafe abortion. Don't they know that this is a risk to their life? And these are some headline stories from the Times of India, which said that in Mumbai, unsafe abortions claimed 34 young lives in 3 years. This was a 2015 article. And this said that because many abortion clinics didn't have qualified doctors. So when I try to look at an analysis of why women do this, I realize that this is because risk is sometimes their only choice. Santya and Verma in this article, looking back, looking forward, tried to tell us why women risk abortions if they are restrictive laws. But we are fortunate in India to have a wonderful law. But here the facilities are too few. They are unevenly distributed in different parts of the country. And in many parts of the country, there is lack of access to qualified providers. In India, a lot of people still perceive abortions as being illegal. In fact, a majority in most studies. The quality of services, unfortunately, is perceived to be poor in the public sector, and that's where the people with the unmet need have to go to. It's not good, it's insensitive, and it can be judgmental. The cost in the private sector is sometimes a substantial financial burden, and it has been shown that the more vulnerable the patient, the higher the cost. And finally, we have to deal with gender roles, stigma, opposition, and a lack of autonomy. So this is the situation which we are still dealing with. 1971, we got our MTP Act, and we are still not out of the woods. Now, we are not alone in this. This was an article in the Los Angeles Times in 2003. And this article was about Roe v. Wade, which was the landmark judgment in the US, which made abortions possible and legal. And they said that back then, every city hospital had a septic abortion ward for women who were nearly killed trying to abort a pregnancy. This was a reality in India. In Wadia, we had a septic ward, which at one time was overflowing with women with a septic abortion. Thankfully, that ward then became the NICU. And I think any person who's practiced in India, say 3 or 4 decades ago, will remember how common this was. This is a reminder that if we take our eyes off the ball, if we get careless, something like this can happen again. So today, Niranjan, I'm going to speak on induced abortions, and I'm going
to... Does medical MTP need orientation for general practitioners? What is your take?
Now, medication abortion can only be done by a general practitioner who has undergone a training program in a registered training site in the public sector teaching hospital, and a few private sector sites which are available, such as the Family Planning Association in Mumbai and some private hospitals. There, the person would have to do a 2-week training, do at least 25 surgical abortions themselves, observed or assisted, and then they are permitted to do a medication abortion. But that might change because the act, which will be hopefully amended now, is always followed by an amendment of the rules. The rules follow the act. The rules have to be amended by the ministry, and only a formality of going through the parliament. It does not have to be voted upon. And I'm sure the next time the rules are written, there will be a rule which will say MBBS doctors need to do a very small orientation program of maybe 2 days, and they should be allowed to do medication abortion. I would definitely fight for that and champion that. In fact, I would go to the extent that if I had my way, I would put a line saying that all MBBS doctors can do medication abortion in the first trimester without needing any additional training.